You ready? 6 feet apart. 6 feet apart. 6 feet apart. Everybody 6 feet apart. Oh, that's good. Thank you. Good morning, everybody. All of our South Florida counties are united here today with Governor Ron DeSantis to share some important news about our continuing effort to stop the spread of COVID-19 and save lives. I want to welcome Governor DeSantis. Also want to congratulate him on the birth of his daughter. Congratulations, Governor. Back to Miami-Dade County and our Lieutenant Governor, Jeanette Nunez. The mayors here joining me today are from Broward, Palm Beach, and Monroe counties, and we all value your support and partnership and your leadership. So please, Governor, we want to hear from you.
Great.
And now, Governor Ron DeSantis.
Great, thank you. Well, let me thank Mayor for all your hard work, even when you were in self-isolation, just still working 24/7. It's been a great partnership to work with Miami-Dade as well as Broward and Palm Beach and Monroe counties. And today, we have all 4 counties united in a common purpose. People from South Florida know it's not always easy to do, but we're all here today to say that we want to win the fight against COVID-19. And so what I'm going to be doing is signing an executive order that codifies a common set of rules regarding safer at home for Southeast Florida. This will build off what Mayor Jimenez has already done and gets all 4 counties operating under the same sheet of music. And the reason why this is important is because we have 60% of the cases in the state of Florida are in Southeast Florida. You have a community here that is our most densely populated part of the state. You have a community here at Miami International that receives a lot of international travel, certainly has over the last few months. Then you have a lot of interaction between South Florida and New York City. And so that has provided more seeds to have the virus in Southeast Florida. And so with this order and what these counties have already done, we're going guns blazing, doing all that we can to be able to slow the spread of COVID-19. And I will say, I think a lot of the actions that you've seen with the mayor and with Broward particularly, I think some of these have been effective, and I think you'll see that as we get going over the next couple of days and weeks. So I want to thank all of them for their leadership. Thanks for the great collaboration that they've had with the state of Florida. And I also want to thank the federal government for supporting some of the initiatives that we have going on down here. One of the things I also want to announce today is, there's a lot of concern about manpower, whether it's law enforcement, whether it's healthcare personnel. You could have somebody that gets exposed to the virus and they have to self-isolate, their contacts have to self-isolate. That creates a potential manpower issue. So I'm also going to sign an executive order today to allow recently retired law enforcement and healthcare personnel to immediately return to the workforce to join the fight against COVID-19. Current law in Florida prohibits personnel that retire from the state workforce from returning to work for 6 months from the date of retirement. I will suspend that prohibition. We need to have folks who are willing to come return to service. Also, just want to mention we have procured for the state of Florida from Teva Pharmaceuticals the hydroxychloroquine, which has been used successfully, anecdotally, in different. Yesterday, the FDA approved its use under the right circumstances for COVID-19 patients. So that's already been distributed to hospitals in South Florida. We want the physicians to be able to have the opportunity to do that if a patient comes in as an infected, and that can make a difference. We've also deployed the first rapid COVID-19 test to South Florida. This is a 45-minute rapid test. We've sent 1,750 to Memorial Health to come return to service. Also, just want to mention we have procured for the state of Florida from Teva Pharmaceuticals the hydroxychloroquine, which has been used successfully, anecdotally, in different parts of the world, really, but here in the United States. Just yesterday, the FDA approved its use under the right circumstances for COVID-19 patients. So that's already been distributed to hospitals in South Florida. We want the physicians to be able to have the opportunity to do that if a patient comes in as an infected, and that can make a difference. We've also deployed the first rapid COVID-19 test to South Florida. This is a 45-minute rapid test. We've sent 1,750 to Memorial Healthcare System in Broward. We've also sent 500 to Northern Florida. And we hope to have very soon an agreement to bring in the 5-minute test developed by Abbott Laboratories. We've asked for a lot of those tests, and as soon as we get them, we will deploy those strategically in the fight against COVID-19. If you look at Florida's numbers, we've seen a huge increase in testing over the last 3 weeks. We're going to continue doing that. We think it's very, very important. We've worked on this Hard Rock site here in Miami-Dade. We did a site, the National Guard, in conjunction with Memorial Healthcare in Broward. We're going to now, tomorrow, open up a site with the National Guard in Palm Beach County, Palm Beach County is a distant third in infections behind Miami and Broward, but they've not had the same level of testing. So we think it's really important to flood the zone in Palm Beach with testing. And so this site, I think, will be able to be a drive-through site where you're going to be able to get a lot of the residents be able to go through in a timely manner. Once we get the rapid test, people will be able to get results sooner. Unfortunately, we still have to send these swabs to the laboratory, but we have definitely done a lot in terms of the testing. And then just updates on with the travel into Florida, the CMS, or excuse me, CDC issued travel advisory for the New York City area about traveling to other parts of the country. That was something we were seeing last week after the stay in place was issued by the governor there. And so we have a system where people are coming in, they're screened, information is taken, they provide the residents where they'll be isolating for 14 days. We think that that helps protect Florida residents. Also doing it on I-10 coming into the Florida Panhandle for a potential New Orleans exodus, and 95 south from Georgia into the state of Florida. Another issue that we're monitoring is the cruise ship coming through the Panama Canal. We think it's a mistake to be putting people into southern Florida right now, given what we're dealing with. So we would like to have medical personnel simply dispatched to that ship, and the cruise lines can hopefully arrange for that, tend to folks who may need medical attention. But I think a lot of these are foreign nationals, and we want to make sure we have the beds available for the folks here in southern Florida. So right now, and we're always monitoring the hospital space, because remember, flattening the curve is making sure that you're spreading this out enough so that the hospital system can cope with it. We have about 30% of the beds in the state of Florida are available right now, and a higher percentage in both Broward and Miami-Dade. We have 32.5% in Miami. The mayor tells me he thinks it's even higher than that in terms of available beds, and so that's a good thing. But then we've also staged field hospitals in Broward and Miami-Dade. I've identified other facilities that could be used. We have additional beds if need be. And then the Army Corps of Engineers will also help us if it comes to that. But I would just say the safer at home is the right move for southeast Florida. This is the time to do the right thing. Listen to all your local officials. We do this until the middle of May, and then we'll see where we're at. But I think a lot of the stuff that's been done has been helpful. I think this will continue to be helpful, and hopefully once we get this thing under control, then we can go back and start enjoying life the way we used to. So I want to thank Monroe County, I want to thank Miami-Dade County, I want to thank Broward, and I want to thank Palm Beach. We're all in this together, and let's continue onward. So safer at home, and I give to you our Lieutenant Governor to say a few words.
Good morning. Thank you, Governor, for your leadership in these very trying times. I'm going to share a few words in Spanish to communicate what the Governor has just said. Hoy el gobernador firmará una orden ejecutiva que refleja el acuerdo entre cada uno de los 4 condados representados aquí hoy día, el condado Monroe, el condado Miami-Dade, el condado Broward y el condado Palm Beach, para adoptar el mismo enfoque en referencia a todas las medidas que se están tomando de una manera uniforme. La orden requerirá que los residentes de los condados de Monroe, Miami-Dade, Broward y Palm Beach cumplan con esas mismas directivas con respecto a los negocios esenciales y no esenciales, según lo dispuesto en las órdenes ejecutivas firmadas por el alcalde Jiménez a partir del 19 de marzo. También el gobernador está ejecutando una orden ejecutiva hoy que lo que va a poder permitir que los policías y el personal de salud recientemente retirados pueden regresar inmediatamente a la fuerza laboral para unirse a esta lucha contra el COVID-19. Nuestras leyes estatales actualmente prohíben que el personal que se ha retirado de la fuerza laboral estatal vuelven a trabajar para el Estado durante 6 meses a partir de la fecha de jubilación. Y por eso esta orden suspenderá esa prohibición. Como oímos, el gobernador ha estado trabajando arduamente para adquirir no solo medicamentos que se han tratado, pero también pruebas rápidas para poder en esta lucha contra el COVID-19. Estamos trabajando muy acerca con estos condados que sabemos que tienen la mayoría de los casos a nivel estatal y por eso le agradecemos su presencia aquí hoy y sabemos que juntos vamos a poder seguir trabajando y venceremos. Le agradecemos toda su presencia and with that I will turn it over to my hometown mayor, Mayor Carlos Jimenez.
Thank you, Lieutenant Governor. It's always great to have you back home in Miami-Dade County. And thank you, Governor DeSantis, for your leadership. The order you announced today establishes a level of uniformity for all of South Florida so that our residents can clearly understand that we can get back to normal quicker if we all join in this together. I want to thank Broward County Mayor Dale Holnitz, Palm Beach County Mayor David Kerner, and Monroe County Mayor Heather Carruthers for joining us today. And I also want to thank Miami Gardens Mayor Oliver Gilbert for all his support. We're actually in the city of Miami Gardens here with this testing site that's located here at the Hard Rock Stadium. And I've been working with the county administrators of Broward and Monroe and Palm Beach to share strategies about how to best crush the wave of COVID-19 cases that we're experiencing. It's clear that this virus has been spreading here in South Florida. It's also clear that when we're together, we're stronger. This is a prolonged health crisis, and to eradicate this virus will take many weeks, maybe even months. That's why the leaders of our 4 great South Florida counties agree that the key message to our residents that we must take personal responsibility and that they should stay at home as much as possible. We must act like we're all carrying the virus and stay safer at home. That's the key message. Safer at home, social distancing. Safer at home. Some people have also asked us why our 4 counties are not in full emergency activation, which is what would happen in a hurricane when high winds and flooding from torrential rain are expected. This is a health emergency, though, and we cannot fully shut down for a month or two. You know, imagine having to provide food, medicine, other essential services for weeks on end to serve 7+ million residents. It's over a third of Florida's entire population. Our 4 counties also have looked at particular situations and found that there's no need to have a countywide curfew at this time. Some cities in Miami-Dade have imposed curfews, particularly in high-density tourist areas, but in most of our 4 counties, a curfew is not necessary. Miami-Dade County streets are quiet, and we should not overburden our fine men and women of the police force when there's no need for a curfew. And thank you, Governor DeSantis, for that order today that allows our recently retired police, fire, emergency personnel to come back and serve. So through collaboration and partnership, Miami-Dade, Broward, Palm Beach, and Monroe counties have agreed to stand united so that our residents understand exactly what they must do and why it's imperative. And again, I also thank the governor for issuing the order that puts the framework for our unity. First, all 4 counties agree that we are safer at home. That's the best way to avoid getting infected. And when you have to go out to get food, medicines, or other necessities, or you're working in an essential or critical business, you must practice social distancing. We've already issued the order. We will close essential businesses. If they don't take social distancing seriously, we'll shut you down. Second, we will not activate as if this were a hurricane or an active shooter incident. This is a prolonged health crisis that the CDC experts tells us require strategic steps as conditions warrant. That means we will remain at a level 2 EOC activation. And third, we're not calling for countywide curfews. I've consulted with the Florida Department of Health about this, and it's simply not necessary on a countywide level. So all 4 counties are on the same boat. I've already ordered in Miami-Dade all parks, beaches, bars, restaurants, hotels, and any other non-essential businesses to close almost 2 weeks ago. Where are people to go if everything but essential services are closed? So you'll hear more from Broward and Palm Beach County about their efforts. And in Monroe County, where the COVID-19 spread started later, there already are stopping visitors from entering the Keys. Now, there may be slight variations in how each county considers critical or what they consider critical or essential, but all 4 counties are in lockstep, and the only way to stop this virus is to act as if everybody is infected, That means stay safer at home. It's a message that's in the best interest of our entire South Florida community. We should all be coming together to fight coronavirus because clearly this global pandemic has no boundaries. So this is why this collaboration among our 4 counties and the state is so important. We're joining forces. We want everyone to act responsibly, and our decisions are based on the best scientific evidence. So again, stay safer and home. And so now I'll bring forward the mayor of Broward County to say a couple of words. So, Mr. Mayor, if you could, thank you.
Thank you very much, Mayor Jimenez. We're facing unprecedented times with this fight against the coronavirus, COVID-19. And it's bringing the best out in many of us. This collaborative effort that is being undertaken here today with Miami-Dade, Palm Beach, and Monroe County didn't start here today. It's been ongoing for some time. Our staff, our administrators have been working together for us to deal with this together. We're truly working as a unit here in South Florida. And I want to thank the governor for his support of all our efforts and all that he's done to provide the resources that we need here in South Florida. Also, I'd like to thank the federal government for signing that $2 trillion bill that now brings help along the way to those most hurt. Our small business, our low-income wage earners are facing the brunt of this severe economic downturn as a result of this health crisis that we face here. And I believe that we're living up to the creed of our country, e pluribus unum, of many one. This virus knows no party affiliation. It knows no ethnicity. It doesn't matter your economic status. It affects us all, and we are in this together. And clearly what's being done today is that we're demonstrating that. For our small businesses, there's loan programs that are available now through SBA. The Florida Disaster Relief Loan Program is also up and running. Take advantage of that. And those who are unemployed, floridajobs.org, you can get help there also. Again, I beg everyone to heed the warning of the CDC and of the health providers that you should practice social distancing, practice preventative measures of washing your hands often. It sounds ad nauseum that we're talking about this continual, but that's how we fight this virus. And together, we're certainly stronger. I thank you all for your support, Governor, and for the other counties for joining force together so we face this virus and beat it. Thank you.
Thank you, Mayor. My name is Dave Kerner. I have the pleasure of serving as the County Mayor of Palm Beach County. And let me start by saying how comforting it is to be here with the leader of our state, our governor, our lieutenant governor, our director of emergency management, and all the mayors and county administrators of South Florida, my home, that I'm a native from, that I love dearly. You know, the governor talked about an aspect of the executive order detailing and relating to law enforcement officers. And the governor also talked about this paradigm shift that's happening in society as we learn to socially adapt to keep certain distances between each other. And it's his belief, and it's a belief that I share, that our communities have risen to this task, and that social distancing and abiding by the CDC guidelines and believing in the strategy to defeat COVID-19 is going to work and is working. This site behind me, and the site that we will open in the county of Palm Beach later today, is a testament to the protection and concern of not just our communities, but also our first responders. And I want you to understand that we have come together as a community. As you look behind us and you look throughout this press conference, there is social distance. There is a recognition of the fierceness of this virus, and that the way for us to defeat it as Americans is to come together. And it's going to get more difficult over time. We've adapted over the last few weeks, and it will become frustrating, and it will become an inconvenience, and it will one that we want to question validity of. I want you to think about every time you abide by those regulations and guidelines and orders from your local officials and from our governor and from our president. It's not just an investment in the safety of your family and of your colleagues and of your neighbors, but it's an investment in the safety and welfare of our first responders, our police officers, our firefighters, our healthcare workers, the men and women who have the same daily fears and risks and concerns that you have when they're at home, but then they go back into society and they fight on our behalf. So every time you ask, should I do this today? Should I abide? Should I believe in the strategy? Don't just do it for your community, do it for the men and women in uniform and in the healthcare profession that keep us safe. Governor, thank you for your leadership during this very critical time. It's an honor to share the stage with you and your incredible staff. Our community should take great comfort in the incredible working relationships that our local governments have with our state leadership. And I just ask that you continue to keep up the great work, sir. Thank you.
Good morning. My name is Heather Carruthers. I'm the mayor of Monroe County, better known as the Florida Keys, and I want to start by thanking the governor and all the mayors for pulling this together, and especially the administrators and the staff that does most of the real work around here. Certainly in our county, our administrator, Roman Castesi, working with the administrators from the counties to the north. I have to tell you that my family was a little concerned when they knew that I was traveling from 150 miles away on an island up to the mainland, given this virus. But I felt that it was important to do because this global virus knows no boundaries. Just like most of our residents don't really know jurisdictions, we work in different areas, we travel to different areas, we are educated in different areas, we go across jurisdictions so that we can get health care and needed supplies. So it's vital for us all to work together, and I'm thrilled that we have this 4 counties cooperation that frankly was sort of, I think, really enforced when we started doing the climate compact work all together. So we all have a good working relationship, and it's important for us to know that if this is a global and certainly a regional issue that we're fighting together. Having said that, Southeast Florida is an extremely diverse community, and each one of our communities has its own character. So we're all going to respond slightly differently to this, but within the same rubric that we're all trying to do, which is to let people know that you are safer at home. In the Keys, of course, a while ago, we did something that we hate doing, and that's telling our visitors that it's time for you to stay home. Reschedule your trip for another time. Our hotels are closed, even our marinas to boaters seeking solace for a day or two. Any short-term stays are simply, this is not the time to do it. We have a checkpoint so that we can remind people who are coming to the Keys that if you don't live in the Keys or you don't work in the Keys, this is the time for you to stay home. It's safer at home. So that's what we're asking you to do. Just go out for the essentials, whether it's food or exercise or to walk the dog or to get medicine. And when you do go out, stay 6 feet away from the people closest to you. Wash your hands, wipe down surfaces. Sounds simple, but this is how we're going to stop this virus. We're a very resilient community down here in Southeast Florida, and I think we can set an example for the whole nation in how we're coming together to fight this. And again, I want to thank the other mayors and our governor for their leadership during this crisis. We're going to get through this together, and we're going to be stronger together. So stay at home, be safe, love your families, and take care of each other. Thank you.
Well, I want to thank the counties for all their hard work. And I also just want to say and add about safer at home as you look over the next couple weeks. Every day where you can make progress against this virus is a huge, huge deal. And the reason is once this thing started rearing its head, we saw it in China. There were things that, we were monitoring in Florida. CDC was monitored everything. But private industry and innovation have really kicked in over the last month. And you have new things coming online, it seems like, almost every day. You're going to have, Mayor was talking about the antibody test to try to figure out how many people have had this. I got to believe that this thing was swirling around Miami during the Super Bowl. How wide was the infection? How many people are asymptomatic? How many different tests are there going to be where you literally will get the results within 5 minutes? So there's all this innovation that's happening. So the more you can do now to stop the spread, the greater opportunities you're going to have to ultimately defeat it, because you're going to have so many more tools at your disposal. We learn more every day as we get in more information. not only at the local level, state level, but what they're doing in Washington. And it allows us to be smarter. But American innovation is ultimately what's going to win the fight against this. Let's give it a little bit more time to develop even more tools. And if we're doing that, then I think that we're going to have a great chance in this. So thank you all. And remember, the message is safer at home. With that, yes, ma'am. Thanks. Well, that's what we're doing now with this. I mean, we have South Florida we view as our epicenter with 60%. But just understand, we were working with Mayor Jimenez, we were working with Mayor Holness, we were working with those counties from day one. And I have issued orders specific for South Florida already. Now this is yet another one. And so we definitely view the Southeast Florida region as a unique part of the state, particularly when you talk about a virus that started internationally and then obviously spread seriously in New York City. Both of those impact Southeast Florida. And so I think a lot of what the counties have done, a lot of times in conjunction with us, has been very aggressive. We've supported every step they've taken, and I think this is yet another example of that. Yes, sir. It's the million-dollar question. I mean, so when we started this, we were one of the first states, Jared's here, we were one of the first states to order all this stuff. That's why we have the field hospital set up. That's why we have additional beds. That's why we're finally starting to get the testing swabs. We ordered 500,000 of those right off the bat. And the PPE was something. So what'll happen is there'll be PPE that's supposed to be delivered at some port. You go and ends up somewhere else. It's really cutthroat. The president talked about it yesterday. We're going to look into this FDA approval for cleaning the PPE. Look, obviously we'd like to have unlimited supply, but at least if you can do that, then they're able to do it. So PPE is a top priority, and I think we're going to continue pushing for it. We are getting some in. But then, like they'll say, you're going to get another 500,000 next week, and it's like, all right, here's 25,000. It's cutthroat, and that's just the nature of it. But when you look at some of the things that we have an opportunity to do, if we get the rapid test, all the healthcare workers will be able to get a result in 5 minutes. That's game-changing for protecting the healthcare workforce. So there's a whole bunch of other things that we want to do as well, but certainly the protection of the healthcare workforce is one of the top issues. What's that? I think it varies by region, to be honest with you. One of the things I did early on was we suspended any type of non-essential medical procedures. And part of the reason we wanted to do that was to make sure that we could expand the amount of beds in case you had a hospital surge. But as I started talking to folks, that was really the secondary reason to do it. The number one reason to do it is because you didn't want to burn through PPE. We just had a baby, and I wasn't in the delivery room because we didn't want to burn the PPE. My wife and I both said, look, let that be for the medical professionals. So that's just, it's something that we're working very hard to conserve. Yes, sir. Yeah, no, absolutely. And we're going to be able to beef up. So we have the testing site here, Marlin Stadium, and we're going to be sending more swabs because as they come in, we get them out. And so clearly Miami is a great, you look at some of the, the testing in Miami, there just wasn't any testing being done here. Like I said, I think that this was circulating in February, but I think it was people would go and it was an influenza-like illness and it just wasn't clear. And then once you started, because at first the CDC said just test people if they come back from China. Well, I mean, there's a lot more people that have been through South Florida. So once we've been able to flood the zone with tests, you've obviously seen more positives. But I think those are identifying things that were probably there. And so now that we've kind of sensed where we're at, as we continue to get results, I think it allows you to make much better decisions. But if I could have unlimited PPE and rapid testing, if I have those two things, and we may get those very soon, that's a huge game changer for us and allows us to be even stronger. Yes. Well, no. So first of all, I'm not supportive of that. Obviously, the county, they're in charge of the port. We've talked to the Coast Guard. The Coast Guard, I don't think wants them to come in. I've talked to the White House about it, and we don't want it to come in. And here's the issue. We met with, Mayor Holness was there, and Mayor Jimenez, we met with all the cruise ship people several weeks ago and said, look, guys, and Vice President was basically like, I'm not saying we're going to totally shut you down, but if you can't operate safely, and they said, no, they were going to take things. So here's a situation where there's nothing about Florida where the ship should necessarily, that's just a convenient place. The problem is then that takes resources away from the folks in South Florida. And yes, we do have available beds, but I don't want to be a situation where those beds could have gone to Floridians. So I think the thing is they need to get medical care out on the ship, and they can work with some of the folks in D.C. or whoever, get it out there, administer the care to the folks there. That averts, I think, which would potentially be a big problem. And, we have enough to deal with our folks in Florida. We've got almost 22 million people, just this area, heavily populated. These guys are working round the clock to support those folks. Having people from other states flee to here or have a cruise ship come in, it creates problems, and we want to focus on Floridians. Yes, sir. So I don't believe I am. I think the county can vote to do that, and I think they're considering that. I've also talked. I think the White House obviously could divert it, and so we're in touch with them. They're supposed to give me an answer on that sometime today, but I'll let the mayor weigh in about the county's perspective.
So as of just a few minutes ago, we have not yet received a request for them to berth. We know that the intent is that they come here. We will have a meeting tomorrow morning at 10 o'clock where we'll further discuss what action we take. But clearly what must be done is that we safeguard the people of South Florida and of Florida. And they haven't given us a full list of all those who are on board and what the conditions are. So there's a lot of work that is yet to be done for us to understand more fully who's on there, what the situation is. But as the governor says, the possibility of having them treated on ship is one that ought to be taken into serious consideration. So there's a lot of work still to be done. There's a lot of things up in the air that we have to figure out. But let me tell you also that at the port, we have a unified command with the Coast Guard, with the Center for Disease Control, with Florida Health Department, with Customs and Border Patrol, with the Broward Sheriff's Office, with the pilots at the port, and with our administration. So whatever decisions being made, that information will be filtered through all of that before any decision. And those conversations will be had tomorrow at our meeting. Tomorrow, yes. Tomorrow there will be discussion on that, for certain. We'll have the discussion on it tomorrow, and some determination will be made.
All right. Yes, ma'am. Thanks. So I don't know that they're not. I mean, you'd have to ask Department of Health on that. I can tell you that if we get the Abbott Labs test, the first place we're going is our senior communities, the assisted living facilities, and the nursing homes, not just to test the residents, but when people are working, because what happened in Broward was you had staff that were sick that were in there, even though we knew they knew that was something you shouldn't do. So you'd be able to test the staff 5 minutes, but then you also will be able to liberalize visitation, because we've walled off these things, and we're doing it for the protection of some of our seniors. But I think that that's not easy on them. And if you have a son or daughter who can test is negative, and they can go in and spend some time, that reduces some of the anguish for these folks as well. So I think the rapid test is going to be a great tool to deploy at nursing homes and at assisted living facilities. And I do think that it's a top priority. But let me just say this: for every, you have the Broward situation. There was one in Jacksonville. We send people from ACA to spot check to do all this other stuff. And some of these facilities are doing amazing work. They're super cautious on everything, and have done a good job. So you see one, and obviously there's investigations going. I think that people are going to be disappointed in how that worked out. But there's also a lot that are doing well. Yes, sir. Well, it's not behind. I mean, so our reporting system in Florida, in terms of how we report to the public, we do it quicker than anybody. If you look at other states, we have way more information than other states. In fact, people have said, I wish everyone was like Florida on that. So as soon as we get it, the public has it, and then we know. Now, you're right. Someone may have been tested, positive, and that may reflect 4 days before. So you look at it. But I think what we look at is trends. Once you have a certain number of tests, Broward is pretty consistently 90% negative. So as we've increased testing, they've had similar positive ratio. Miami's a little bit, more. But as the mayor has pointed out, the number of positive tests, that is one thing you look at, but understanding how this disease affects different people differently, looking at what percentage of those folks are 65 and plus, what percentage of those folks have a serious underlying condition, and then what's the net hospitalization, and then obviously we want to avoid fatalities. So Miami's numbers, as you've had the infections reported higher, their hospitalization rate, I would say, is definitely below the national average for what you guys have. 6% in Miami, between 6 and 7. So those are the things that you're looking at. And especially, remember, flattening the curve is not saying that we can stop the virus at all. I mean, it's kind of a recognition. Respiratory virus, it just has a way of getting out. So you take these measures so that you're shifting some of these infections further into the future so the healthcare system doesn't get overwhelmed. So that's the type of thing, looking at the test results, but then seeing how that's affected our hospital and our healthcare system. That's really the two things. They go hand in hand. Yes, ma'am. Right. You have to ask my communications. I do not, deal with the press conferences. I just go up and do my thing, and so I'm happy to answer. Obviously, you're here now, and I think I've answered more questions than just about any governor since I've been governor, and I'm happy to do it. Yes, sir. Well, but I would say, so, I mean, we've gone from, even with limitations on the type of testing you're doing, you went from probably when CDC was doing it, if you go back and look at it, they were not even 1,000 tests done. So then we've gotten involved, and we've worked with the locals, and we have had some federal support, and then you now have tens of thousands. I mean, Broward's at least 10,000 tests, Miami's 10,000, so we're going to keep doing that. If I get the rapid tests to come in, they're going to be making 50,000 of those a day. So Florida, I asked the president personally, not that they have to pay for it for us, but all these manufacturers are looking to the White House about where they should send stuff. And my pitch on Florida was, look, I have a spot in Southeast Florida. If I could rapidly deploy that, particularly amongst in the senior community, we would be able to really have measures that would be in place that would be pinpoint of what we need to do. And so I think that would be something that would just be absolutely phenomenal. But as frustrating as the testing has been, we in February, when the only people that were being tested per CDC was if you had been in China. So we were actually isolating people for 14 days if they had come back from China. Then you added Italy. But if you were just someone here with symptoms, CDC says that you didn't need to be tested. I don't think they thought that the virus was really present in our country, and that may obviously have been incorrect. And so had the testing been a little bit more robust, we may be in a situation where we would know the better baseline. Because I know that had Miami tested, and it's not Miami's fault, but had there been more tests, I think you would have obviously seen more positives in late February than you have right now. But we're much better shape we've done over 50,000 tests in basically 2.5 weeks in Florida. When we stood up the guard, when we really started ramping this up, and I think we'll do, we're probably going to be doing, once we have the Palm Beach site up between Broward, we're going to be doing thousands and thousands every single day. And I would point out, we have set up sites around the state. Fortunately, there are some parts around the state where a testing site gets very little traffic. There aren't as many people that have symptoms. I think that's a good sign. But as we see the need, we obviously are willing to shift resources. One more. Yes, ma'am. Yes. I'll let you go too. But they wanted to ask about the baby, so let me brag just a little bit. It's surreal being in a hospital during this time. And as I said, I did not go into the delivery room because of I didn't want to burn PPE. It was a kind of sad thing, but my wife and I both felt that was the right thing to do because really there's going to be people that need it more than us. And then to have a third, she was the smallest of the bunch. But it's like when my daughter was first born, my older one, it was the prettiest thing I'd ever seen. And then my son, he's a cute kid. But I'll tell you what, this one is really, really cute. And so and she's sleeping very well. And this is a tip for parents. My son's two. This wasn't in existence when he was even born. It's a technology. There's a thing called the SNU bassinet. And you put the baby in there, and there's sensors and microphones in the bassinet. And so if the baby starts to cry, it logs it, and then it tries to figure out how you do noise, movement. What do you do to soothe the baby? Then the information goes to my wife's smartphone, and you see it. So last night, we put Mamie in the bassinet, and she started crying, and then the thing just started doing all this stuff. And guess what? She didn't make a peep all night. So the SNU, look, if one night's any indication, it is definitely worth your money if you're a young parent and you care about your sleep. One more. Yes, ma'am. So what's happened is when that happens, so like in Jacksonville, they did 65 and plus with symptoms, and then first responders and healthcare workers. The traffic was so light that they basically said, look, if you have symptoms, come in. And so that expanded the pool a little bit. So I think it's the call of here. My view is, as much as we can expand without giving people a false hope, like if we have the supplies, expand it. I think that's a good thing. It's interesting in the numbers. Statewide, you look at the infections, but you also look at them by age group. And we actually are seeing more infections, I think, reported than we thought in the 20s to 30s and even 40s. Those folks, if they don't have an underlying condition, tend to get out of this much better. And so I think that's something that is important to understand. We're also trying to work with CDC, and I think they're trying to set it up. But with the flu, now obviously everyone that has the flu doesn't go in and get tested. You kind of just deal with it. But, we have deaths. I mean, Florida, even though we have one of the lowest death rates, we got about 3,000 deaths a year from the flu. So what they do is they do spot sentinel testing, so they see where the flu is popping up in different parts of the state. And so they're going to do something similar for COVID-19. And the idea is you're testing a representative sample of society. If you start to see some positives in, say, like North Miami Beach or wherever, then you can do resources accordingly. So I think that sentinel testing, once that's in place, and I think that's going to be more of a federal deal since the flu is a federal deal, that allows us to really see if it starts cropping up. Because, we're obviously thinking about, safer at home. We're thinking about getting through stopping the spread. But I think everyone realizes, like, you can't do this indefinitely. You're going to have society function again. And what does that look like? Well, having this type of information allows you, to have a functioning society. And it may look a little different because this thing isn't going to totally go away, but I think it will allow people to hopefully have some peace of mind, but also, be a little bit more involved as they're used to doing. So, thanks everybody.
Yes, ma'am. What would you? Yeah, we're gonna distance. Sí, obviamente eso es algo que siempre estamos preocupados. Aquí en el condado Miami-Dade y en el condado Broward hay muchas ciudades dentro de nuestro condado, pero el propósito de hoy para el gobernador era tener esa plataforma uniforme entre los 4 condados. En ningún momento el gobernador está diciendo que esto es lo único que puede hacer un condado o una ciudad. Pueden tomar otras medidas, lo cual hemos visto en la ciudad de Miami, ciudad de Miami Beach, porque tal vez ellos tienen otras dificultades que tienen que contender, que tal vez el condado entero no necesariamente tiene que contender con esas inquietudes. Pero yo creo que es importante tener la plataforma unida entre los 4 condados, porque lo que estamos viendo es que la mayoría de los casos están localizados aquí y obviamente los números, lo que estamos viendo, no solo las personas infectadas positivas, pero como habló el alcalde, lo que es las hospitalizaciones y los fallecimientos, algo que estamos tratando de verdad buscar la manera regional de enfocarnos en eso. Bueno, obviamente lo que hemos visto en el norte de la Florida, hay muchos condados que no tienen ni un solo caso. Y además hay muchos condados que tienen 10 casos o menos. Eso es algo obviamente mucho más fácil de tratar de contender cuando estás hablando de una pandemia de esta magnitud. Y por eso él ha estado enfocado en hacer las medidas más estrictas aquí en el sur de la Florida. Entendemos que los negocios en el norte de la Florida tienen otros retos y obviamente no es lo mismo cuando no tienes un solo condado decirle a los negocios que tienen que cerrar, los negocios no esenciales, que sería no solo devastador para aquella economía, pero no tiene lógica y no está recomendada por la CDC y otras entidades federales.
Bueno, esto es un esfuerzo para combinar el mismo mensaje en 4 condados y también para dar el mensaje también a esas ciudades que tienen un diferente mensaje, que este es el mensaje que debe todo el mundo aquí en el sureste de la Florida debe tener, más seguro en la casa. También que tenemos que enforzar lo que es las medidas de la distancia social. Para mí es mucho más importante cuando estás haciendo una necesidad que te mantenga la distancia social. Por eso es que la policía del condado de Miami-Dade está enfocado en eso. Cuando están las personas en la calle, enfocar en mantener la distancia social, y si no lo hace, pues vamos a cerrar entonces el negocio. Eso para mí es mucho más importante de otras medidas que han hecho. No vamos a empezar a parar todas las personas que están en las calles, en las ciudades y el condado, para ver qué están haciendo. Lo que es importante cuando estás haciendo una necesidad, que te mantenga la distancia social, y que si no estás haciendo eso, es mejor porque estás más seguro en la casa. Ese es el mensaje del condado de Miami-Dade, de Broward, de Monroe y de West Palm Beach. También es el mensaje del gobernador. Así que la razón que tuvimos eso es que hay tanta confusión. ¿Qué quiere decir? Todo eso quiere decir la misma cosa. Quédese en la casa. Si tiene que hacer una necesidad, puede salir, pero mantenga la distancia social. Y entonces estoy muy agradecido al gobernador por tomar este paso para unir esta frase. Eso es lo que se debe decir, eso es lo que tenemos que tener en mente. También que pueden hacer tus necesidades, pero cuando tú salgas, tienes que mantener la distancia social. Y otra cosa también, mira, muchas personas están enfocadas en las pruebas. Las pruebas sí son importantes, pero lo más importante es cuántas personas están yendo al hospital, cuántas personas necesitan las cámaras de intensidad y cuántas personas necesitan respiradores. Y te puedo decir que, aunque hemos tenido mucho más personas que son positivas, y te voy a decir que hay muchas más personas que son positivas, lo que es importante es cómo está creciendo, si tenemos los suficientes números de camas vacantes en los hospitales. Tenemos más de 3.600 vacantes, tenemos más de 300 unidades de intensidad, ICU, y tenemos más de 700 respiradores ahora en el condado de Miami-Dade, 300 más que se pueden convertir inmediatamente, así que estamos bien en eso. Eso es lo que más importante, que cuántas personas son positivas. El examen es muy importante para las personas que le van a dar cuidado a las personas de tercera edad y también las personas que tienen necesidades médicas, porque si ellos entonces le pasan el virus a esas personas, entonces los números de las personas que van al hospital necesitan más ayuda, necesitan respiradores, eso va a subir. Así que todo el mundo está enfocado en los exámenes, yo estoy más enfocado cuánta gente está yendo al hospital. ¿Qué? Estamos en más de 40% vacantes. Estamos en los medios 40, puede ser hasta alto 40. Eso cambia todos los días. Tuvimos en 48, ayer tuvimos en 46, pero hay más de 3.600 cuartos de hospitales que están vacantes hoy en día en el condado de Miami-Dade. Todos necesitamos mantener la distancia social. Si mantenemos la distancia social, si también lavamos las manos mucho más frecuentemente, vas a evitar la contaminación de este virus. Por eso es que ese es el mensaje. Lávate las manos, no te toques la boca, no te toques la cara. Mantenga los 6 pies, mantengan los 6 pies. Y si si los negocios no van a mantener esos 6 pies entre sus empleados y también empleados y clientes, van a tener un problema con el condado de Miami-Dade. Nosotros ya le hemos dado más de 200,000 comidas a las personas de tercera edad. Nosotros, acuerdo las medidas que tomamos bastante temprano. Cerramos todos los centros comunitarios del condado de Miami-Dade, las personas que eran mucho más vulnerables. Puede ser que por eso está el nivel de hospitalization, está más bajo, está como al 6%, y también que las personas que necesitan respiradores y ICU es más bajo que la cifra nacional. No es necesario. Todos los condados estamos en acuerdo. También todos los sheriffs están en acuerdo que las calles después de las 10 están muy tranquilas. No necesitan un toque de queda, porque entonces quiere decir que tenemos que contratar más policía durante ese tiempo para enforzar el toque de queda. Algo que mi director de la policía ha dicho que no es necesario, y los sheriffs de Broward, de Palm Beach y también de Monroe ha dicho que no es necesario. Así que en lo que es los 4 condados no tenemos ningún tipo de plan para implementar un toque de queda. Ahora, ciudades, si ellos quieren, pueden hacerlo, pero con los condados, las áreas no incorporadas, eso no es algo que nosotros creemos que es necesario, y tampoco los expertos que yo he hablado de salud han dicho que también que no es necesario en este momento, porque no hay nadie en las calles, no hay nada abierto que ellos tienen que ir. Así que se tiene que asumir que las personas en las que están en las calles por la noche están yendo a su trabajo, que es una necesidad. Puede ser en la ciudad de Miami, pero en turismo ya todos los hoteles están cerrados. Todos los restaurantes están cerrados. Así que yo fui por la ciudad de Miami antes del toque de queda por la noche, y no había nadie en las calles. Ahora, si ellos desean hacer eso, las ciudades lo pueden hacer, pero en los condados no lo vamos a hacer. Eso crea un poquitico de confusión. Estoy en la ciudad de Miami, no estoy en la ciudad de Miami, estoy en la ciudad de Miami Beach, estoy en Coral Gables. Hay ciertas ciudades que sí, pero la área más grande, la no incorporada, no es necesario. También no es algo que está recomendado por el director de la policía. No, lo más que es preocupante, no es que cuántas personas son positivas, porque te voy a decir ahora, hay muchas más personas que son positivas que no se han probado. Te lo voy a decir. ¿Cuántas personas están yendo al hospital? ¿Cuántas personas están utilizando lo que es el ICU? ¿Cuántas personas están utilizando los respiradores? No hemos visto un crecimiento en el mismo nivel de positivo. Acuérdate, la mayoría, y parece que la gran mayoría de las personas que si tienen este virus no saben que lo tienen, no supieron que lo tienen, o si lo tienen, los síntomas son leves. Por eso es que todos tenemos que, para de verdad ganar esta batalla, asumir que todo el mundo lo tiene, que se queden en la casa lo más posible y cuando salen a la casa mantener su distancia social, porque tú lo tienes, yo lo tengo, ella tiene, todo el mundo aquí tiene el COVID-19. Tenemos que asumir eso y así hacemos eso, es mucho más importante de cuántas personas de verdad lo tienen, porque es mucho más importante la manera que nosotros estamos actuando y en esa manera podemos empezar a bajar los números de las personas que lo tienen y entonces un menor chance de contaminar personas que sí van a tener consecuencias muy negativas si cogen este virus. Yes. Yes. There apparently companies are now converting to creating, manufacturing hand sanitizers. We in the county have had a problem in getting hand sanitizers, and so that's going to be a problem. So what's the next best solution? Warm water, soap, 20 seconds. Sing happy birthday twice as you wash your hands in warm water, and that's as good as any hand sanitizer. Make sure you do a thorough job. And so more hand washing with good old plain soap and water, warm water, 20 seconds, as good as hand sanitizer. If you push an elevator button, once you push an elevator button, go wash your hands with soap and water. If you have hand sanitizer, fantastic. That's what I do whenever I touch a surface. I've just touched these surfaces. I will not put my hands up to my face. I will then find a hand sanitizer or soap and water, and then I will wash my hands to make sure that's disinfected. Yes. If what? Well, like the governor said, that the problems in South Florida and Southeast Florida are completely different than the problems in the Panhandle. I mean, they have no cases up there, and so I actually support the governor's view. This is not a one-size-fits-all solution. This is where this is where a good majority of these cases are. We have to take these measures because we are an international city. A lot of international travelers, a lot of people from New York come here to Southeast Florida, and I know we have a big problem in New York, and so we're taking these measures because it's necessary for us. We also have a big, large elderly population here in Southeast Florida, and so I think the governor's approach is being very strategic, being very surgical. We can support that, and I do support the governor's efforts, and I also got to thank the governor for everything he's done for us here in South Florida. Jackson Memorial is our public health hospital. We have every morning we talk about how many beds they have, how many ICU beds, and how many respirators they have in Jackson Memorial. They have plenty of respirators now to take over any peak. And again, even though we've had a good jump in the number of positives, it's something that we thought was going to happen. We haven't seen a big jump in the number of hospitalizations or in the number of people using respirators. Our average we have over 11, I think we have 1,400 cases that are positive. We have 100 hospitalizations. That's about 6 to 7% is actually hospitalized. And by the way, that's a running total. That's cumulative. That means that there may be some folks that have already been hospitalized that have left the hospital that are still in that 100. So again, we look at how many hospital beds are available, how many ICU beds are available, how many respirators are available, and we haven't seen a big jump in the decline in the vacancy rate, in the ICU use rate, and also the respirator rate. Yes, we've had an increase, but nothing that's alarming at this time. PPEs are a problem everywhere across the nation, and we have had we have a sufficient number here to last us maybe a month or so for our public safety, police, and fire, but it's a problem. It's a challenge. And so people, like the governor said, the private sector is coming up with all different kinds of solutions that they can implement right away. There's a big market, obviously. When there's a big market, somebody's going to come up with a solution. So, but it takes a while to get it into the marketplace, get it in the supply chain. We're having difficulty just like everybody else. Okay? Thank you very much. God bless you all.
three countries you mentioned, we wouldn't compare them to Korea or to Japan or to Singapore in terms of their situation. They have much more extensive problems. And then if you compare them to what happened in China, and specifically in Wuhan, which was the most intense epidemic, we did see, rather than basing this on modeling, let's base it on experience, right? If we saw what happened in Wuhan after the lockdown, and not only did they do that physical distancing and put people in their homes, but they continued to look for cases. That's the essential difference. They continued to detect cases and isolate all cases, including mild cases, away from their families. But let's assume they've done that. What we saw over a period of days, and I think you were one of the people who asked the question during the Wuhan event, do you think this is stabilizing? Is it going down? And for a number of days, we said, well, we can't tell, and it went up and down and up and down. So what we're likely to see, if you imagine the lockdowns and the stringent measures that were put in place are now in place for between 2 and 3 weeks in Italy at different levels in different places, we should start to see a stabilization because the cases we see today really reflect exposures 2 weeks ago. So the cases you see today are almost like historical, in the same way when we're told that we're looking at galaxies through a telescope, that we're seeing light from 1 billion years ago. We're seeing a reality that existed before. When you count your cases on a daily basis in an epidemic, it reflects a reality of transmission and risk 2 weeks before at least. So in that sense, what we see today is what happened 2 weeks ago. And what we hope to see is those numbers stabilizing, which will reflect the fact that exposure started to drop over time. And some countries, as I said on Friday, have seen that through the number of contacts per case. When they've continued to look for cases, they've still done contact tracing. And what they've found through the physical distancing measures and the stay-at-home orders is the number of significant contacts per case has dropped from the 20s to 15, to 12, to 10, to 8, to 4, which means less people have been exposed to that case than would have been 2 weeks ago, which shows people are distancing. For whatever reason, they're distancing. So there are less people at risk from any individual case. If you get those cases out of the community quickly, they'll expose even less people. And that's how you get ahead of an epidemic. So do we hope that Italy and Spain are nearly there on that? Yes. But the way you stabilize and then move to zero, and I think everyone's talked about the curve up, and everyone talks about the stabilization. The question is, how do you go down? And going down isn't just about a lockdown and let go. To get down from the numbers, not just stabilize, requires a redoubling of public health efforts to push down. It won't go down by itself. It will be pushed down. And that's what we need countries to focus on. What is the strategy now to put in place the public health measures that will push down the virus after those measures may be released? And then how do we take care of people better in a clinical environment to save more lives? So yes, potentially stabilizing, and it is our fervent hope that that is the case. But we have to now push the virus down, and that will not happen by itself.
And if I could just add to that, what I was going to say, which Mike has just said, is we need to focus on the now. We need to focus on what must be done now to get us out of this. And there is this, I understand completely the desire to want to know when we will reach the peak and when we will start seeing that decline. But that will not happen on its own. These physical distancing measures, these stay-at-home measures have bought us a little bit of time, a little window of time. And that short window has to be used appropriately so that we get systems in place to look for this virus aggressively through testing, through isolation, through finding contacts, through quarantining those contacts, through caring for further patients, because we will still see patients, and many patients are still going to require need, to support other countries that are going to go through this. So the focusing on what we do now is absolutely critical to make sure we use that time wisely, we use that time effectively, so that once we do reach that peak, that we continue to push and suppress that virus down as quickly as possible, but still be ready to find additional cases should they show up. What we've seen in a number of countries in Asia, and that where they've brought this virus down, they've brought transmission down, they're now seeing repeat introductions from outside of their countries. They have not let their guard down. They are still aggressively looking for those cases as they come in and suppressing it so that it doesn't start again. So we need to focus on the now. We need to use our time wisely, and that is to aggressively find this virus and care for our patients.
Thank you very much. Next question is from Nippon TV, Atsuko. Atsuko, can you hear us? Can we try one more time with the Nippon TV? Okay. That's okay. So let's go to Jim from Westwood One. Jim, can you hear us?
Yes, thank you very much. Very good afternoon to you. I would like to clarify a little bit on the chloroquine issue in the U.S., and it should be important to point out that the FDA hasn't approved it for wide prescription by doctors, but only in a hospital setting, and the doctors there can only get it from the national stockpile. But my question is, what exactly was observed with chloroquine or hydroxychloroquine that could lead to the possibility of it being used to treat COVID-19 in a hospital setting? And what do you mean exactly by randomized testing as opposed to non-randomized testing? If you could answer those, I'd appreciate that. Thank you.
Maria will supplement. I mean, there was somewhat people will describe as in vitro evidence in the lab that the drug was active against the virus, but any number of things are active against viruses. Chlorine is active against viruses, but other things are active against viruses. The question is whether they're safe and effective to put in a human body, and whether they will be absorbed and processed in a way that the virus can be attacked and not the body. From the perspective of chloroquine, there were also some small observational studies, one in France, that followed a small number of patients where there was no randomization of those patients and looked at their outcomes. Patients were admitted at different stages of illness, and the outcomes that were really focused on was the length of illness. And the observation that was made was that people, length of illness or length of hospitalization or length of significant symptoms was reduced. No one here is talking about cure. No one here is talking about taking a magic pill and all of a sudden you recover from COVID. Everyone's looking for therapies that will shorten the disease illness, will prevent people going from moderate to severe, and will prevent those that are critical dying. And drugs act in different ways. Some drugs may actually prevent the virus replicating early in the disease and therefore shorten the length of the illness and reduce the progression to severe disease. Once the disease is very well established and in a later stage of the disease, a lot of the damage that's being caused by the virus has not necessarily been caused by the virus itself, but all of the secondary effects, the inflammation, the drug or the organ failure and other things that happen. So a lot of antiviral therapies are focused on getting a person with the disease treated at an earlier stage of disease. And if you look at a lot of the anti-flu medications like Tamiflu and others, their main benefit that has been found for those, again, has been shortening the course of illness. With regards to randomized control trials, the importance of having a control group is to have a comparison. And then be able to stratify your patients, because if I have a drug and I treat a very severe patient who's of an older age with the drug and that person dies, does it mean that that drug didn't work? And if I treat a really healthy young person who's got a moderate disease and they recover, does that mean the drug worked? And I don't think any of us need to be rocket scientists to work out that there are many factors that predict recovery or predict death. And what we have to separate and we have to distill out is what is the effect of the drug itself, not the age of the patient, not the condition of the patient, and so many other factors that can affect survival. We've all been through infectious diseases ourselves and we recover. Is that because, we get out of one side of the bed or the other? No, we wouldn't assume that that was affecting the outcome of the illness. There are many natural things affecting illness outcome, including the hard work of doctors and nurses in supporting the patient and preventing organ failure and ventilating the patient. So the difficult thing at this moment is distilling out the specific effect of a drug in a complex illness. And that's what we're trying to do with the randomized controlled trials. And that's why we need so many patients in those trials across many countries, many age groups, genders, many phases of the disease, and many levels of severity. And then we can break out what is the actual effect of the drug on the outcome of the disease.
Only to add that there are a number of clinical trials that are ongoing. Mike has described the French study that I'm aware of as well. But there are a number of clinical trials that are ongoing that look at chloroquine, that look at a number of other therapeutics. And on the one hand, it's incredible to see this acceleration of research and development and this focus on the evaluation of therapeutics for COVID-19 patients, which is building upon a history of other respiratory pathogens that have plagued us. But the challenge is that many of these clinical trials are small in size, which makes it very difficult to draw any conclusions, which is why it is very important that we have these larger trials, these multi-site trials, the Solidarity trial that WHO is running, to be able to have enough cases to be able to get an answer to which drugs work safely.
Thank you very much. We have time for one or two more questions, so I'll try with Bloomberg and Naomi. Naomi, can you hear us?
Hi, yes, I can. Thanks for taking my question. Wanted to ask, we've seen some different approaches to quarantine in China and in European countries, with group quarantine used to good effect in China. Do you think that home quarantine will be as effective anywhere for people who are positive, or would central quarantine be needed in order to have the same success that China had?
Hi. So we get our terms right and we can explain ourselves properly. We tend to use the word isolation for someone who is a case confirmed. We tend to use the word quarantine for someone who's at risk of being a case, usually a contact. So on that basis, we advise that all suspect cases are tested and all suspect cases are isolated in an appropriate medical facility. I think nobody disagrees with that, where the capacity exists. When we come to contacts, it very much depends on the context and the intensity of the epidemic at any given moment. In low incidence areas where there are sporadic cases or clusters, we advise that all contacts should be quarantined. Ideally, that quarantine should occur in a place other than the home. And for this reason, one, because if that person gets sick, they may already have infected their family. But that's not always possible. So at least quarantining contacts at home with good health advice about not transmitting disease if they become sick, and with regular monitoring of that individual, is an option for countries. It is difficult to do that in the middle of intense transmission, where you might have hundreds of thousands of contacts because you're having thousands of cases a day. It is difficult to deal with that. So home quarantine of contacts is acceptable with appropriate information, education, and more importantly, a very rapid system of getting those people out of their homes if they become sick. I listened to the president of Singapore this morning, and he had a conference call with the Director General, and the clarity of that in Singapore, that ability not only to isolate cases, but to rapidly detect illness in the contacts and remove those contacts should they become sick, was a central part of that. And as he said, that wasn't, they're using apps now to do that. They're testing apps, but they didn't do it with apps in Singapore. They did that with community workers, with public health workers, visiting the houses, checking on people, checking their health status every day and saying, how are you? Have you got a fever? Have you got a cough? And if a contact has developed a cough or a fever, they were taken immediately for testing. So yes, we need the information technology tools. They help. They are not the solution. Right now, we don't have an alternative to what we would have considered in the old days boot leather epidemiology. Public health practitioners, doctors, nurses, community workers working with communities to detect cases at community level. And the most likely person to become a case is someone who's been a significant contact of another case. And at the moment, in most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner. So that's what I was saying previously about the transition from movement restrictions and shutdowns and stay-at-home orders can only be made if we have in place the means to be able to detect suspect cases, isolate suspect confirmed cases, track contacts, and follow up on the contact health at all times, and then isolate any of those people who become sick themselves.
Thank you very much. As we try to have a variety of different outlets being able to ask questions, we don't have quite often sports outlets, so I will call on Diane from soccer.com. Diane, can you hear us?
Yes, I can hear you. Can you hear me?
Yes, please go ahead.
Hello?
Yes, please go ahead with your question. Diane, let's try one more time. Can you hear us? We were hearing you very, very well.
Yes, I'm sorry. I'm having my phone. Hello, can you hear me now?
Yes, please go ahead.
There is such a discrepancy of information regarding the validity of masks, and I know that you have addressed this, and there's a great deal of fear regarding medical professionals having access to it. But is there any type of qualitative research that can confirm that the masks, wearing a mask prevents the spread for normal transmission in going to the supermarket, in day-to-day activity?
I can start, and perhaps Mike or the DG would like to supplement. So this is an area of very active research. There's a lot of use of masks globally for different diseases, for influenza, for other coronaviruses, for this particular outbreak. But there isn't a lot of quantitative analysis of this. And what we know works, we know that people who are sick and they stay home, that works because that prevents them from spreading the disease to someone else. We know that washing your hands works because we know that or using an alcohol spray scrub, because that will remove the virus from your hands. We know that physical distancing works because that removes the opportunity to spread that virus from one person to another. We are working with a large group of people across the globe and our IPC specialist networks to look at the use of masks in very